We are the NMAP.
We heal with zeal.
Together, we navigate
New frontiers.
Hello, I'm Dr. Gargi. We are currently seeing numerous school children with high-grade fevers and typical viral-like features like multisystem involvements and playful interfebrile periods. However, these fevers are lasting for more than 72 hours and in some cases for more than a week. Let's check out what are the features of an adenoviral etiology. This medium-sized virus may enter the body through several routes such as respiratory droplets, hand-to-eye contact, and through fecal-oral route. It is highly contagious as an infected person secretes 10 raised to 5 to 10 raised to 6 virions per ml of sputum, while the infective dose is just 5 to 6 virions. There are more than 54 recognized serotypes and each is associated with a different system involvement like 3 and 7 with meningitis, 11, 21 with acute hemorrhagic cystitis and several others with respiratory and gastrointestinal diseases. Once the virus enters the body, the incubation period for respiratory illness is up to 14 days, whereas for gastrointestinal disease it is 3 to 8 days. The disease ranges from mild uneventful to fatal disease associated with 7. It is important to note that latent infection can stain the tonsils and other lymphoid tissues and can be shed out for years. Respiratory illness can range from rhinorrhea, snoring, cough and pharyngitis to tracheobronchitis, bronchiolitis and pneumonia. Fatal pneumonias are rare and usually seen in infants. The gastrointestinal disease is indistinguishable from rotavirus illness with non-bloody watery diarrhea which precedes vomiting and lasts for 1 to 2 weeks. It may be complicated by intussusception. It is also associated with conjunctivitis which is mild granular and unilateral before it becomes bilateral. Visual haziness indicates keratitis or corneal inflammation and may last for months to years. Preauricular lymphadenopathy, called the Perinaut syndrome, is rare but highly suggestive of human adenovirus. There can be hematuria in case of febrile nephritis and rarely in immunocompromised children, acute hemorrhagic cystitis. Diagnosis is by molecular methods. PCR technique is used. The disease is usually self-limiting except in keratitis, where early topical steroids by an ophthalmologist can preserve vision. The absence of T-cell specific immunity determines poor prognosis. Ribavirin and cidofovir have been used with variable success. However, pooled IVIGs have shown some success. Intravesical cidofovir in case of isolated acute hemorrhagic cystitis have shown some effect. There are limited studies on the use of antivirals as well as IVIGs. Vaccines against type 4 and type 7 serotype have been in production for 2 decades but only for military use. Standard droplet precautions and supportive therapy are the only way to go ahead. Please avoid antibiotic usage unless there is any specific indication to do so.